There's a little bit of confusion as it relates to hypermobility syndrome and Ehlers-Danlos syndrome. I mean, let's be honest, it's just a spectrum. So at the one end of the spectrum, you just have a loose jointed person who's doing fine. You know, they might be a gymnast, or they were a gymnast, or they're just somebody who knows that they have really good flexibility. They love yoga, right? The people who can do all the maneuvers in yoga, you know, they're probably people who were born with loose joints. There's good things about having loose joints in that you age very well, because isn't it true, as we age, your body stiffens up. So if you're a loose jointed person, as you age, you're going to age great, because your motion is just going to go within the normal range as you age. The bad part about it is when a loose joint becomes unstable. When a loose joint becomes unstable, that's when you need to get an evaluation for prolotherapy, because prolotherapy can stabilize the joint. Now, at one end of the spectrum, you have people who are just loose-jointed people. They have benign congenital hypermobility. And at the other end of the spectrum, you have Ehlers-Danlos syndrome, where you actually have a genetic disorder where the ligaments are really, really stretched out. So those folks tend to have a lot of joint dislocations. If I could say anything of any condition that really, really needs prolotherapy, I would say it's Ehlers-Danlos syndrome. So I hope that in the future, people with Ehlers-Danlos syndrome diagnosis will learn about prolotherapy and get an evaluation by somebody who does prolotherapy. We've had experience here at Caring Medical between Dr. Hemwell and myself over the course of the last 50 years of treating a lot of people with Ehlers-Danlos syndrome. And we've definitely had folks that were in wheelchairs and now they're not in wheelchairs. We've had people that were disabled and they've gone on to get PhDs in, you know, college. They're doctors now because, you know, the prolotherapy stabilized the areas that were disabling them, and now, you know, they basically live pain-free. So even if you've had the diagnosis of Ehlers-Danlos syndrome and you're getting a lot of dislocations, and we've had people that have come here who have already had like 20 orthopedic surgeries because of all these dislocations, and received prolotherapy and, you know, benefited from the prolotherapy and gotten back to, you know, somewhat normalcy. And we've even had folks who would come here for 2 days. You know, in other words, they have almost every joint of their body affected, and one day we would do, say, the front side of their body, and then the next day we would do the back side of the body. And some of those folks, we would give them conscious sedation because it is so many injections. So we use like Demerol and substances like that to make the procedure more or less painful for them. So just realize even severe cases, and our clinic's known for handling really, really severe cases, can benefit from prolotherapy.